My name is John McConnell. I am an eye surgeon, and eye surgery is not involving just surgery, but an ophthalmologist deals with a lot of conditions which affect the body generally, and many of these have an effect on the eyes. There is one group of conditions called autoimmune diseases, many of which have an effect on the eye. And this is a subject which is a little difficult to understand, and I want to try and explain in simple terms what an autoimmune disease is. There are almost 100 autoimmune diseases. The cause of these has not been established, although many theories exist, ranging from genetic predisposition through geographic and climatic factors to hormonal influences. Although all probably play a part, the essential pathological abnormality has not been determined. Autoimmune diseases result from an individual producing antibodies which attack the individual's own cells. Normally, antibodies are produced by the so-called B cells to defend the body against viruses, bacteria, and other harmful invaders, which are foreign. We do not have an explanation for the reason that antibodies may be produced against self. Cross-reactive antigens occur when one antigen, for example a foreign one, is so similar to another of the individual's own that when the T cells stimulate the B cells to produce antibodies, these attack the self tissue in a misguided attempt to defend what has been wrongly perceived to have been an invader. This attack results in inflammation in the host tissues, and it is this inflammation which is the hallmark of autoimmune disease. The theory which I find most plausible is related to the influence of animal protein. The protein of cow's milk is casein. When a child is exposed to cow's milk at a young age, antibodies may be produced against the casein, hence milk allergy, but the casein as an antigen is very similar to some of the child's own tissue antigens, and on subsequent exposure to milk, the individual may produce antibodies to its own self-tissues, with consequent inflammation resulting in autoimmune disease affecting that tissue. It's likely that other proteins, especially animal protein, can similarly lead to inappropriate antibody responses by the body to its own tissues. Because the fundamental process in all autoimmune diseases is the inflammation which results from these antibody-antigen reactions, and inflammation is a result of free radical damage, a diet rich in fruit and vegetables will provide antioxidants which will neutralize the damaging effect of free radicals.